deaths in women. Cervical cancer is caused by the HPV virus and is preventable through vaccination and screening. The vaccine against HPV has now been available in the country for over 10 years, but shockingly, the uptake remains low. Let's hear more on this from Dr. Marion Diana, consultant obstetrician and gynecologist. She's also the Secretary General of the Kenya Medical Association. Thank you so much for your time, Dr. Ari.
Thank you, Lilian.
I want us to begin with a scope of the uptake of the HPV vaccine in the country.
So we rolled out the national vaccination in the year 2019, and the data that has been collected along the way is we are giving it in two parts. So the percentage that has been covered that is the full vaccination, is 1 in 10 girls. That percentage brings it to a level that basically you are realizing if we take the total population of the girls that we are covering, which is 9 to 14 years, and we have only vaccinated 1 in 10, so you take that total population of those girls, and you know our coverage is poor. Yes.
Now, you know, what is the resistance about? I mean, this uptake clearly is very low at 13%. What would you attribute the resistance to?
So we have several factors we can look at. The very first factor is awareness. We have, as a country, we have not taken time to really educate the population about, just generally about cervical cancer, because we have a lot of misconceptions about it. We've also not taken time to educate people about the HPV vaccine, because we also have a lot of misconception around the HPV vaccines. Then we also have issues around the anti-vaccine campaigns generally. But there is the concept that HPV is actually related to a sexually transmitted infection, because HPV is sexually transmitted. So the moment you talk about HPV vaccine, someone is asking you, why are you giving the vaccine to children? You see? So the resistance is a little bit higher, but it's a lot more around awareness. Mm-hmm. If we could educate the population a little bit more about the fact that actually the sequela for HPV is a long journey. It takes up to around 15 years from exposure and infection to actually you developing cervical cancer.
Does the vaccine work for women who are already sexually active?
Yes. So when we talk about vaccines, it's about immunogenicity. In terms of when we talk about HPV, your body generally has the immune system that should be able to clear the HPV. But we have a percentage of women that are not able to clear the HPV. And this small percentage is the one that will actually develop the persistent HPV that will cause changes in the cells. And those changes in the cells can eventually lead to cervical cancer. Mm-hmm. So for the women that are already sexually active, one of the things that we do is that they are also eligible to this vaccine. The only difference is you don't have the primary, you already have an exposure. And if you have an exposure, then what we do is, first of all, screen you. So we will screen you, and how do we screen you? We will do a pap test. For the pap test is easier done because it's cheaper, mm-hmm. But we can also combine it with the HPV DNA. One of the things I would like the viewers to know is that the HPV DNA will just show that you have the HPV with you. But it doesn't show you have cervical cancer. Mm-hmm. But if we screen you and we realize that the vaccine is going to protect you, then we will give it to you, even if you're already sexually active.
Walk us through cervical cancer screening and what these gadgets are briefly.
Cervical cancer screening should be a routine test. We have a national cancer screening program, and what they use is something they call VIA, or what we are using is acetic acid. So what we do, we put acetic acid on the cervix and we look at it. Mm-hmm. So what happens is that if you actually have abnormal cellular changes, it will take up the acetic acid.
Are we talking about screening every year for women who are sexually active? What are we looking at in terms of the frequency of the testing and the screening?
So it's actually advisable to start your screening by age 21 if you are sexually active, or at least 3 years after the onset of sexual debut. So what we look at is once we start the screening, between the age of 20 to 29, we recommend a pap smear is just adequate every 3 years.
Every 3 years. All right, so walk us through how exactly that is done.
What we need are cells from the cervix. So the cervix is the lower part of the uterus. To take anything from the cervix, then I need to access that part through the vaginal space. For me to get there, then naturally I will use a gadget like this. These ones, we call them speculums. A speculum just opens up the vaginal space so that I'm able to see the cervix. The beautiful thing about an examination with a speculum is that you are able to actually pick other things, infections, abnormal discharges, any lesion that is not normal. You'll be able to pick it quickly because that's a pelvic examination. But once I'm able to access the cervix, then I will take, this is something we call a cytobrush. So I'm able to see that cervix. So I'll get that to, I don't know if you can see that.
Yes.
So I'll get it to the cervix, and usually we just turn it. It's a very simple procedure.
So it's like a brush.
It's a brush. The speculum helps to open up because the cervix is right in there. And what I do is that I will get my brush in there. And you realize this brush has
bristles.
Yes, but it's you can see that projection in the middle. This goes inside the cervical canal, like that. Because when we are getting cells, we want to get cells from something we call the endocervix, or the inside of the cervix, and we also get from the ectocervix out there. So we do that, we rotate that nicely. So we are collecting our cells. Now, what we do naturally, we have 2 options. So I can do this smear on a slide and then fix it for the pathologist to talk about it. Or I can actually collect that, put it in a liquid-based solution, and take it again for the pathologist to look at those cells. And then the pathologist should be able to describe these cells for us. Now, there's something I would like our viewers to know. Number 1, a pap smear is a screening test. It does not tell that you have cancer, but it will tell us that there's something wrong with your cells, if there is, or it will tell us there's nothing wrong. So most of the time you will get a report from the pathologist that will tell you normal, or it will tell you we have low grade, or it will tell you we have high grade. And with that, there's also a journey to it. So your gynecologist should be able to explain to you how that journey goes. So if, for example, you have abnormal cells, we have the low grade, you will get advice that we can repeat that pap in 6 months. What does that tell you? That your body can actually clear the abnormal cells. So if I repeat in 6 months and that has not happened, then we might need to move to the next step. But if I repeat in 6 months and it has happened, then we continue with the normal screening processes.
We're talking about this cancer being a curable cancer if detected early. So let's talk about treatment and indeed, cases of remission and how possible it is to actually cure this cancer if detected early.
Now, this pap smear, if it tells me it's abnormal cells, for me to progress to the next step, which is now going to be diagnostic steps, what I need to do is send you for something we call a colposcopy. If, for example, the cells are telling me I need to make a diagnosis. So colposcopy is a nice gadget where cells are seen under high magnification, and we do the same staining that we are talking about to just pick the abnormal cells. So where we see the abnormal cells is where we take the biopsies. Then we send this again to the pathologist. So when we get to the level of diagnosis, then that's when we start now having various levels of treatment. Now, the beautiful thing about regular screening is that we will catch you early. So if we catch you early, what do? We treat you. Now, what are the available options of treatment modalities for patients we capture early? So we have various options, and we have something we call laser excision. It's basically electro surgery where we excise, where we see the abnormal cells with a special loop gadget that just cuts out the area that has abnormal. The pathologist will again look at this to tell you if the margins are clear of abnormal cells. Or you can go for a cone biopsy. Again, this will be done by a gynecologist who will take a larger portion of that cervix, because now we are looking at what point will you have a cone done? It's done because maybe the lip comes back and tells you never covered all the margins. Or it is done when we are thinking about we need to take a bigger portion of that. So you take a bigger portion where they do a cold knife biopsy or conization, and they take that out. Now, for the advanced lesions, you will actually see the lesions, and that is beyond screening. If I do a pelvic examination on a lady and I see an obvious lesion, I will take a biopsy straight on. So they will skip this process of screening. But we are trying to, if we could get these patients without getting to the advanced stages, in our country, 90% of the diagnosis for cervical cancer is made when we are already in the advanced stages. The moment you get in the advanced stages, most of the time your treatment is a combination of many things. So we'll have either radiotherapy, chemotherapy. There's a point you don't even qualify to have surgery. But in the early stages, you can also have surgery, but it's also extensive surgery because you have to get out all the tissues where the cervical cancer can go. So we really look at a point whereby we'd rather prevent than really try to fight at the end, yes.
Prevention is better than cure.
Yes.
Essentially is where we end our conversation. Thank you so much for your time.
Thank you.